Prostate cancer is often called the silent killer. Why? Because it creeps up with symptoms so subtle. Many men miss the warning signs entirely. But here's the truth. Early detection isn't just helpful, it could save your life. Did you know that 1 in 8 men will be diagnosed with prostate cancer in their lifetime? That's millions of husbands, fathers, and brothers unknowingly living with a ticking time bomb. Even more alarming, over 34,000 men will lose their lives to prostate cancer this year alone in the United States. Yet, here's the good news: when caught early, the survival rate skyrockets to an incredible 98%. This video is your guide to understanding the 9 early warning signs of prostate issues, including some surprising ones you may not expect. I'll break down exactly why these signs happen, how to recognize them, and what to do next. Don't assume small changes in your body are just part of getting older. Subtle symptoms like frequent urination, unusual fatigue, or unexplained discomfort could be your body's way of signaling something serious. And ignoring them could mean missing the window for early diagnosis and effective treatment. Stay with me because the final sign, number 9, is one most men completely overlook. Yet it could be the difference between catching the disease early and letting it progress. You'll want to hear it. Your health matters. Your life matters. By paying attention to these 9 warning signs, you can take action now and make choices that protect your future. Let's get started with the first sign, one that many men dismiss as just a part of aging. Don't ignore it. Let's dive in. Early warning sign number 1. Unexplained pain in the lower back or hips. Unexplained pain in the lower back or hips may seem like an ordinary ache, easily attributed to aging, long hours of work, or physical exertion. For many, it is brushed aside as just another discomfort that will fade with time. However, when the pain persists, worsens at night, or feels deep and constant, it could be signaling something far more significant. The lower back and hips are critical areas connected to the prostate's location in the body. The prostate gland sits just below the bladder and in front of the rectum. When prostate cancer develops, especially in more advanced stages, it can spread to nearby bones, including the pelvic bones, spine, or hips. This spread, known medically as metastasis, often results in lingering, deep-seated pain that is not easily relieved with rest, stretching, or over-the-counter medications. The nature of this pain is what makes it different. It does not behave like a simple muscle strain or soreness. Instead, it tends to intensify over time and may disrupt sleep or make daily activities like walking, sitting, or bending increasingly uncomfortable. Some individuals describe it as a dull, unrelenting ache, while others experience sharp, radiating discomfort that seems to travel through the pelvis and hips. It is important to understand that this type of persistent pain is not always a direct indicator of prostate cancer. Other conditions, such as arthritis, herniated discs, or chronic injuries, can present with similar symptoms, but pain that continues without explanation, especially when accompanied by other subtle changes in the body, should not be dismissed. When the body experiences ongoing discomfort, it is offering a sign, one that invites closer attention. Persistent back or hip pain, particularly in men over the age of 50, deserves to be taken seriously. Pain, though often seen as a nuisance, is the body's way of speaking, and sometimes, its message carries life-saving importance. Early warning sign number 2. Persistent pelvic or rectal pain. Persistent pelvic or rectal pain is a symptom that often goes unnoticed or dismissed, especially when it starts mildly. Many people associate it with digestive issues, muscle strain, or even prolonged sitting. However, when the discomfort lingers, deepens, or becomes a recurring sensation, it could indicate an underlying problem within the prostate. The prostate gland is located in the lower pelvic region, close to the rectum and bladder. When this gland becomes inflamed, enlarged, or affected by cancer, it can press on nearby structures, leading to persistent pain or a feeling of pressure in the pelvic area. Unlike occasional aches or soreness, this discomfort tends to be constant and is not relieved by simple rest or over-the-counter remedies. For some, the pain can feel dull and achy, spreading across the lower abdomen or deep within the rectum. Others describe a sharp, concentrated discomfort that worsens when sitting for extended periods. Activities like bowel movements, urination, or even prolonged standing may intensify the sensation. It is important to note that pelvic or rectal pain is not always linked to cancer. Conditions such as prostatitis, which is inflammation of the prostate often caused by infection, can cause similar symptoms. Benign prostatic hyperplasia, a non-cancerous enlargement of the prostate, can also create pressure in this region. Yet, when pelvic pain is persistent or unexplained, especially in men over the age of 50, it is a signal worth paying attention to. The body rarely gives signals without reason. Pain in the pelvic region or rectum, particularly when it lasts for weeks or progressively worsens, is one of the ways the body may alert someone to changes happening internally. Recognizing the difference between ordinary discomfort and persistent pain is key, as understanding these subtle signals could allow for early detection of a potentially serious issue. Early warning sign number 3. Blood in urine or semen. Blood in urine or semen is a symptom that can stop anyone in their tracks. It is alarming, unexpected, and often misunderstood. For many, the first instinct is to hope it is just a one-time occurrence, perhaps caused by minor strain or irritation. But even the smallest streak of blood in urine or semen, whether visible to the eye or detected through testing, deserves attention. The medical term for blood in urine is hematuria, while blood in semen is known as hematospermia. Both can result from various causes, including infections, injuries, or inflammation of the urinary or reproductive systems. However, when prostate cancer is involved, the underlying reason often relates to changes within the prostate gland itself. As cancer develops, it can disrupt nearby blood vessels, causing them to leak blood into the urinary tract or seminal fluid. Blood in urine may appear pink, red, or brown, depending on the amount present, while blood in semen can create streaks or discoloration that many overlook at first. Some may notice the symptom alongside other changes, such as pain during urination, discomfort in the pelvic region, or frequent bathroom trips. Even without additional symptoms, the presence of blood is a clear indicator that something may be amiss. It is worth noting that not all cases of hematuria or hematospermia signal cancer. Kidney stones, urinary tract infections, and prostate inflammation are common causes. Yet, for men over the age of 50, the symptom cannot be ignored, especially when it recurs or appears alongside other unusual signs. The body communicates through symptoms, often quietly at first. Blood in urine or semen is one of the more vivid signals, a warning light that cannot be dismissed as normal. Recognizing this early and understanding its significance can offer a critical opportunity to address potential issues before they progress further. Early warning sign number 4. Frequent or urgent urination. Frequent or urgent urination is one of the most common signs of changes in prostate health. Yet it is often mistaken for a normal part of aging. Many men find themselves waking up multiple times at night to use the bathroom or struggling with an unrelenting need to urinate throughout the day. While this may seem like a minor inconvenience, it can signal an underlying issue that should not be ignored. The prostate gland, located just below the bladder and surrounding the urethra, plays a key role in urinary function. As the prostate grows or changes, it can press against the urethra, narrowing the pathway through which urine flows. This causes the bladder to work harder to push urine out, resulting in symptoms like increased urgency, difficulty holding urine, or the sensation of not fully emptying the bladder. Frequent urination is especially noticeable at night, a condition known as nocturia. For some, it begins with 1 or 2 bathroom trips, but over time, it can interrupt sleep several times each night. This constant disruption can leave individuals feeling exhausted and drained during the day. Urgent urination, on the other hand, can occur suddenly, with little to no warning. Men may find themselves rushing to the nearest bathroom or struggling to hold their urine in situations where it was once manageable. These changes can significantly impact daily life, affecting work, travel, and simple activities like attending a meeting or watching a movie. It is important to remember that while these symptoms are often linked to benign conditions like an enlarged prostate, known as benign prostatic hyperplasia, They can also indicate more serious concerns, such as prostate cancer, persistent urinary changes, especially when paired with other signs like pelvic discomfort or blood in the urine. Should be taken seriously. When the body repeatedly signals a need for attention, it is providing an opportunity to recognize an issue early and take meaningful action. Early warning sign number 5. Painful ejaculation or sexual discomfort. Painful ejaculation or sexual discomfort is a symptom that many men hesitate to talk about. It is often dismissed as a temporary issue or simply attributed to stress, fatigue, or aging. However, discomfort during intimate moments can carry important clues about prostate health, and understanding why it happens is essential. The prostate gland plays a significant role in sexual function. It produces seminal fluid, which mixes with sperm during ejaculation to form semen. When the prostate becomes inflamed, enlarged, or affected by cancer, this vital process can be disrupted, leading to pain, discomfort, or even reduced semen volume. For some, the discomfort feels like a sharp, localized pain during or immediately after ejaculation, while others describe a dull ache that radiates to the lower abdomen, groin, or rectal area. Sexual discomfort may also be accompanied by other subtle symptoms. Men might notice a decrease in the intensity of their orgasms, lingering soreness in the pelvic region, or an overall feeling of tension. These changes, though sometimes mild at first, can become persistent over time, affecting both physical comfort and emotional well-being. While painful ejaculation can result from non-cancerous conditions, such as prostatitis or benign prostatic hyperplasia, it should never be ignored when it occurs regularly. Prostatitis, which is inflammation of the prostate often caused by infection, can cause similar discomfort, but prostate cancer may also trigger these changes as the disease progresses. It is important to recognize that symptoms affecting sexual function are the body's way of signaling that something may not be right. They are not a normal part of aging or a sign to be ashamed of, but rather an opportunity to understand and address changes in prostate health. When discomfort becomes consistent, it serves as a reminder to take these signals seriously, as early awareness can make all the difference. Early warning sign number 6. Swelling in lower limbs, edema. Swelling in the lower limbs, known as edema, is a symptom that may seem unrelated to prostate health at first glance. Many people associate swollen legs or feet with extended periods of sitting, standing, or even minor injuries. However, when swelling becomes persistent, uncomfortable, or progressively worse, it could be pointing to a more serious issue within the body. The prostate gland, when affected by advanced cancer, can cause disruptions in the body's lymphatic system. The lymph nodes, which are responsible for draining excess fluid from tissues, are often located near the prostate. If cancer cells spread to these nodes, they can obstruct the natural flow of lymphatic fluid, resulting in noticeable swelling in the legs, ankles, or feet. This type of swelling is often more pronounced in both legs and may come with additional symptoms like tightness, skin discoloration, or a heavy, achy feeling in the lower limbs. Unlike swelling caused by prolonged inactivity, edema linked to prostate issues does not improve with rest or elevation and tends to worsen over time. Some individuals may even notice discomfort or changes in the texture of their skin as the condition progresses. It is important to recognize that swelling in the lower limbs can have other causes, including heart disease, kidney problems, or deep vein thrombosis. However, when it occurs alongside other subtle symptoms, such as pelvic pain, frequent urination, or unexplained fatigue, it warrants closer attention to the prostate. The body often provides small signals when something is amiss, and swelling in the lower limbs is no exception. Persistent edema, particularly in men over the age of 50, is not just a matter of discomfort but a sign that something deeper may need to be addressed. Understanding these signs provides an opportunity to listen to the body and act before the issue progresses further. Early warning sign number 7. Unexplained weight loss and fatigue. Unexplained weight loss and fatigue can often be overlooked as simple consequences of a busy life, stress, or aging. For many, losing a few pounds without effort might even seem like a positive change. However, when weight loss happens suddenly and without a clear cause, especially when paired with persistent fatigue. It could be a sign of an underlying health issue, including prostate cancer. Weight loss related to cancer occurs because the body's metabolism is disrupted. Cancer cells consume a significant amount of energy as they grow and spread, effectively draining the body of essential nutrients. This process can lead to rapid weight loss, often accompanied by a loss of muscle mass and noticeable changes in physical appearance. Individuals may find that clothes fit more loosely, even though they have not made any intentional changes to their diet or exercise habits. Fatigue, on the other hand, is not the kind of tiredness that can be relieved by a good night's sleep. It is a deep, ongoing exhaustion that lingers throughout the day. Men experiencing cancer-related fatigue may struggle to perform routine tasks, feel drained after minimal activity, or require frequent rest just to get through their daily responsibilities. These symptoms do not occur in isolation. They often develop alongside other subtle signals, such as pelvic discomfort, urinary changes, or pain in the lower back. While unexplained weight loss and fatigue can also result from other medical conditions, including thyroid disorders or diabetes, they should never be dismissed when no obvious cause is present. The body relies on energy to function, and when that energy begins to deplete for no clear reason, it is a signal worth recognizing. Sudden weight loss paired with persistent fatigue, especially in men over the age of 50, offers a critical opportunity to investigate deeper changes that may be occurring. By acknowledging these signs, the body's message can be heard and acted upon before the issue becomes more advanced. Early warning sign number 8. Difficulty starting or stopping urination. Difficulty starting or stopping urination is a symptom that many men encounter but often dismiss as a natural part of aging. At first, it may seem like a minor inconvenience, struggling to begin urinating or experiencing a weak, inconsistent stream. However, these disruptions in normal urinary function can be an early indicator of changes within the prostate and should not be ignored. The prostate gland surrounds the urethra, the tube responsible for carrying urine out of the body. When the prostate becomes enlarged or affected by cancer, it can press against the urethra, narrowing the passage and disrupting the flow of urine. This can result in hesitation before starting, weak flow, or the feeling of dribbling after urination. Many men describe the experience as standing at the toilet and waiting longer than usual for the stream to begin or being unable to fully stop, leading to an incomplete or inconsistent experience. Over time, this difficulty can worsen, causing increased frustration during routine activities. Men may feel the urge to strain to push urine out, only to find their efforts yielding little relief. This hesitation and lack of control can also lead to a lingering sense that the bladder is never truly empty, prompting multiple trips to the bathroom in a short period. While benign prostatic hyperplasia, a non-cancerous enlargement of the prostate, is a common cause of these urinary changes, prostate cancer can produce similar symptoms as it grows and disrupts normal function. It is the persistence and progression of these changes that signal the need for attention, especially when they are accompanied by other signs such as frequent urination, pelvic pain, or fatigue. The body is designed to work in harmony, and disruptions in something as routine as urination often indicate that deeper changes are occurring. Difficulty starting or stopping the flow of urine is not just an inconvenience, it is a message, a clue that the prostate may be undergoing changes that warrant closer examination. Early warning sign number 9. Numbness or weakness in legs. Numbness or weakness in the legs is a symptom that may feel unrelated to prostate health at first. It often starts as a mild tingling sensation, similar to what might occur when sitting too long in an uncomfortable position. However, when numbness becomes persistent, accompanied by weakness, or even affects movement, it may signal a more serious underlying issue involving the prostate. The prostate gland is located near the lower spine and pelvis. When prostate cancer progresses to advanced stages, it can spread to nearby bones, particularly the spine. This spread, known as metastasis, can compress the spinal cord and surrounding nerves, disrupting normal nerve signals that control movement and sensation in the lower body. As a result, men may begin to notice tingling, numbness, or even loss of strength in their legs. For some, The weakness starts gradually, making it harder to stand for long periods, climb stairs, or carry out simple physical tasks. Others may experience a sudden and pronounced sensation of heaviness in their legs or difficulty with balance. In severe cases, the compression of spinal nerves may also cause changes in bladder or bowel control, an indicator that requires immediate medical attention. While numbness and weakness in the legs can stem from other conditions such as nerve damage, herniated discs, or diabetes, its presence alongside other symptoms, like persistent pelvic pain, urinary changes, or unexplained weight loss, points to a need for a closer examination of prostate health. The body relies on the nervous system to function seamlessly, and disruptions in sensation or movement are rarely random. Numbness and weakness, particularly when they appear without explanation, act as a clear signal that something deeper may be occurring. Recognizing this symptom offers an opportunity to address underlying issues and regain control before the condition progresses further. The 9 early warning signs we've discussed are your body's way of speaking when something is amiss. If this video has helped you recognize even the smallest signal, you're already taking a powerful step toward protecting your health. For more videos that empower you with vital health information, make sure to subscribe and stay informed. Let's now explore the risk factors you need to know to stay ahead of prostate cancer. Risk factors for prostate cancer. Understanding the risk factors for prostate cancer is essential for early awareness and prevention. While anyone with a prostate can develop this condition, certain factors increase the likelihood of its occurrence. Recognizing these factors empowers individuals to take proactive steps toward safeguarding their health. Age is one of the most significant risk factors. Men over the age of 50 face a higher risk of developing prostate cancer, and this risk continues to increase as they grow older. The majority of cases are diagnosed in men over 65, making regular screenings particularly important for those in this age group. Family history also plays a crucial role. Men with a close relative, such as a father, brother, or son, who has had prostate cancer are at a higher risk. This increased likelihood stems from shared genetics or environmental factors within families. Certain inherited gene mutations, like BRCA1 and BRCA2, which are often linked to breast cancer, may also elevate the risk of prostate cancer in men. Hormonal imbalances are another contributing factor. Elevated levels of testosterone or androgens, which fuel the growth of prostate cells, can increase the risk of abnormal cell development in the prostate gland. Monitoring hormonal health as part of routine checkups can help identify changes that may signal a potential issue. Lifestyle choices also influence prostate cancer risk. Men who lead sedentary lives, maintain poor diets rich in red or processed meats, or struggle with obesity are more likely to face aggressive forms of prostate cancer. Excess body fat, especially around the abdomen, may affect hormone levels and trigger inflammation that fuels cancer growth. While some risk factors, like age and genetics, cannot be controlled, others, such as diet, exercise, and weight management, offer an opportunity to take charge of long-term health. By understanding these factors, individuals gain the tools to make informed choices that may reduce their risk of developing prostate cancer and improve their overall well-being. Proactive prevention strategies. Taking proactive steps to prevent prostate cancer is one of the most effective ways to support long-term health. While no method guarantees complete protection, adopting healthy habits can significantly lower the risk of developing this condition and improve overall well-being. A balanced diet is an essential foundation for prostate health. Nutrient-rich foods like tomatoes, which are high in lycopene, have been shown to reduce inflammation and slow abnormal cell growth. Cruciferous vegetables such as broccoli, cauliflower, and Brussels sprouts contain compounds that support the body's natural defenses against cancer. Adding sources of omega-3 fatty acids, like salmon, flax seeds, and walnuts, can help reduce inflammation and promote a healthier prostate. At the same time, limiting red and processed meats, sugary foods, and unhealthy fats is key to minimizing potential risk. Regular physical activity plays a critical role in prevention. Exercise helps regulate hormones, maintain a healthy weight, and boost immune function. Activities like brisk walking, Swimming, cycling, or light strength training for at least 30 minutes a day, 5 days a week, can make a significant difference. Even small lifestyle changes, like choosing the stairs instead of the elevator or taking short walks throughout the day, contribute to better overall health. Weight management is another important step. Excess body fat, particularly around the abdomen, can disrupt hormone balance and increase inflammation, factors linked to prostate cancer development. Maintaining a healthy weight through mindful eating and regular exercise can reduce this risk. Regular screenings and proactive conversations with healthcare providers are equally vital. For men over the age of 50, or those with risk factors like family history or hormonal imbalances, prostate-specific antigen (PSA) tests and digital rectal exams (DRE) offer valuable tools for early detection. Proactive prevention strategies empower individuals to take charge of their health by making informed dietary choices, staying active, and prioritizing regular checkups. The journey toward a healthier future becomes both achievable and rewarding. Friends, if you found this video helpful, don't forget to hit the like button, share it with others who might benefit, subscribe, and tap the notification bell for more health-boosting tips. Together, we can raise awareness and help more people take control of their health. Stay informed, stay proactive, and take care of yourself. See you in the next video.